The countdown to Halloween is entering its final days, but are you prepared to keep you and your family safe? Steve Rappaport takes a look at what medical professionals say is one of the most critical dangers threatening you and your loved ones this spooky season.
As Halloween approaches, health officials say it's never too early to teach your kids about staying safe while trick-or-treating, with medical experts citing how cars, not candy, are the real dangers this spooky season.
Almost all the stories of poisoning or things like that or tampered with candy turn out either to be pranks or to be apocryphal, in the sense that when they're followed up by the police, they're not real. The few times there have been real instances of candy being laced with drugs or poison, it's almost always been family members. And the danger's coming from inside the house, not from other houses.
Instead, healthcare professionals warn pedestrian accidents are more common on Halloween than any other night of the year.
Lots of them are out when they would not usually be, and drivers aren't used to that. Secondly, it's often during rush hour when people are trying to get home from work, and so there's lots of cars on the road. Third, it gets dark often, and sometimes trick-or-treating occurs in the dark, and that makes it really hard for cars to be seen. In addition, kids sometimes run out onto the roads.
If you can, go trick-or-treating while it's still light outside. Officials also advise not putting children in dark-colored costumes or masks that can obstruct their vision. Never let kids go out unsupervised, provide them with flashlights or reflective gear, and take them around neighborhoods you're familiar with.
Happy Halloween to you!
Steve Rappaport, Fox News.
As drug overdoses increase, more states move to make fentanyl test strips and Narcan available. Joy Addison has more on how these products can save lives.
We saw over 100,000 deaths from drug overdose last year, and now advocates and the National Institute on Drug Abuse says harm reduction tools could reduce the number this year.
The 12 months that end up in March 2022 show continued rises in overdose mortalities from fentanyl.
Dr. Nora Volkoff with the National Institute on Drug Abuse says most people overdosing from fentanyl don't know it's what they're consuming.
This initially was disguised within heroin, and then subsequently now it's being disguised in cocaine, in methamphetamine. It's being disguised in illicit prescription pills.
The overdoses that we've been the closest to recently have been adolescents who are taking what they think is Xanax.
Dr. Volkoff says there is a solution.
The distribution of sort of fentanyl test strips, and this allows for a drug user to test the drugs that they are going to consume.
But as of last month, fentanyl test strips remain illegal in at least 19 states. It's often considered drug paraphernalia. She says distributing Narcan, also known as naloxone, is also another option.
Distribution of naloxone is one of the most powerful tools that we have to reverse overdoses and save lives.
Ohio, Delaware, and Iowa are currently the only states that provide Narcan for free. Now advocates and leaders across the country are seeing a desperate need for government Narcan funding.
The governor's office has criminal justice grants that may have the possibility of providing funding for Narcan. One way or the other, we'll find the resources to make sure that we're saving the lives of innocent people.
Advocacy groups say increasing access to Narcan and fentanyl test strips could have a dramatic impact.
Saving taxpayer money from the hospitalizations, it's increasing access to the overdose reversal medicines, meaning less people losing their lives, hopefully.
According to CBS, 41 states have legalized the sale of Narcan without a prescription. California residents can find Narcan for free at community health centers. In Houston, Joy Addison, Fox News.
Stay with us. We'll have more after the break.